How often do you take your car in for a tune-up? Or when it makes a noise or the oil light comes on? You don't cover the oil light with a magic marker, you take it into the mechanic. Chiropractors are spine and body mechanics, put simply. Hi, if you're wondering how often you should see a chiropractor, you're not alone. Maybe you just started seeing one and you're not getting the results you expected by now. Well, this is the video for you. This is one of the most common questions I get. Hi, my name is Dr. David Kulla, board certified chiropractor, certified ergonomic assessment specialist, and nutritionist at Synergy Wellness in New York City for over 22 years now. This is not a simple question, and the answer is not the same for everyone. But I'm going to help you break it down to figure out if and how often you should see a chiropractor. There are a few factors that play a role in how often you should see a chiropractor, and whether or not maintenance care would be a wise decision for the health of you and your family. First, ask yourself this. Number one, do you or someone you know or love have old chronic injuries, multiple injuries, some of which still nag you and were never completely resolved, like the headaches or back pain you keep taking pills for to mask the symptoms, or the foot or knee pain that may be causing you to walk a little differently, creating another problem in your hip or low back, but hasn't properly been dealt with yet. Or number two, what's aggravating your condition? Do you sit all day? Do you stand all day? Do you have to reach overhead or lift heavy weight regularly? Are you overweight? Out of shape? Repeating the same motion incorrectly for several hours a day is a great way to aggravate or perpetuate the very problem your chiropractor is helping you to fix. Be part of the solution, not the problem. Take an active approach to help yourself and your chiropractor get you the results you want and need. Aggravating factors and past health history play a large role in maintenance care. Think about it. What do you do for the maintenance of your teeth? You brush and you floss multiple times a day, I hope, and see the dentist for 2 cleanings a year. Your teeth only chew food, that's it. Your spine and nervous system control everything in your body, from your muscles and organs to every cell in your body. So what do you think? Is maintenance care for the spine important? Absolutely. And number three, another factor that cannot be overlooked is the health of your spine and nervous system. I did a really great video that explains the 3 phases of spinal degeneration. Depending on which phase you're in, depends on how often you should see a chiropractor for a tune-up, or what we call maintenance care. Speaking of tune-ups, how often do you take your car in for a tune-up? Or when it makes a noise or the oil light comes on? You don't cover the oil light with a magic marker, you take it into the mechanic. Chiropractors are spine and body mechanics, put simply. Now that being said, I typically start patients out at 2 to 3 times a week. If pain and range of motion is bad, I start them at 3 times a week until symptoms improve 50%. This could be 1 week, or in more severe cases, 2 to 3 weeks. Then we lower the visits to 2 times a week for 4 to 8 weeks. When we see 75% improvement in symptoms and function, we lower the patient to once a week for a few weeks. Maintenance care varies depending on the previous factors I mentioned in the beginning of this video. It's recommended to see your chiropractor for maintenance care once every 1 to 3 months, depending on the degree of spinal degeneration, your health history, and whether or not you've corrected those daily aggravating factors. I hope you guys like this video. Be sure to click on the thumbs up and subscribe to our channel. We have 4 videos coming out every week. But more importantly, if you have a question or comment, make it below. Thanks for tuning in, and see you next time.